getting there, uh, getting to the practice on time, and yeah, just that interaction that's quite cool with the not with the receptionist, and not knowing what to expect, what mood they will be in, just not knowing who you're going to see, like just all the unknowns of the space, the doctor that you might end up seeing, and what the atmosphere is going to be like. So the whole process of going there already can be quite um, tiring and anxiety inducing. Before, when I had to call the GP by phone and call at a specific time and then wait, and it would just be just another reason not to call or to have missed the time frame.
Yes, some things they do is like if it's like blood tests or stuff, they try and put my appointments together and they try and keep it in the surgery so I don't have to keep going back and forth and get confused.
I book my appointments online and you can just write down the reason, which already helps because there's already like you have time to prepare the note of what you want to discuss, um, which is not the case when most of the time when you're calling the GP practice. The words out there if it's hard for you to say them.
I know that they're trying, but like I don't really like it when they like speak like really patronizing because I feel like for me, I feel like I don't want to talk because I feel like embarrassed for them. You know, if I feel embarrassed for them if I come out with full sentences and like, able to communicate to a high level.
It's also a welcoming space that's quite neutral. There's people are asked to not speak too loud, and I think it's already the case that most GP surgeries are like that. That it's not chaotic. There's not this chaotic atmosphere. That it's a little bit of a ritualistic aspect to it. You walk in, you speak to the receptionist, and then they tell you to sit down, and there's no, not too many stimuli going on. Yeah, and if that weren't the case, like if it were more that's more bustling with people or so, or maybe having the opportunity to go somewhere, if you have to wait for a longer time, go somewhere private maybe, or somewhere a bit quieter. Because I've had many GPs in my last 10 years in London, and they've all been very different. Like there's the really calm ones, and then there's one where people are like shouting names and like like I don't know if because I never know if I'm getting the name right, because um yeah, I don't know. I have this thing of sometimes I find it hard. I think they said my name, or did they not? Did they? Or are they trying to say it? And because it's a foreign name, they don't know how to say it. And so I've sort of freeze. And so yeah, maybe something more digital, or when a name comes up, which I've had in other GPs surgeries, that's useful because then it says, oh, it's your turn now.
It will be at the end of the day, so my GP can have a bit more time to discuss things through. I think that he's very good and giving me some extra time. Like he doesn't like talk so much. He doesn't, because some other GP they like overwhelm me with information. I think having body maps or anatomy maps, and you can just maybe point to where it hurt. I think it's really important that they have those visual stimuli, especially when they're explaining things back to you. Because if you're just using your mind all the time to visualize what the problem is, it can get really confusing. And some language can be broken down and explained a bit more, but that's why I feel like it's good to go back to visual too, even if they can't show it like physically, like maybe on their computer they can show me what's happening.
I always ask, because the two things that I think are important are flexibility and patience. Hey, I know it's hard at the NHS, but just to be patient, to talk slowly, and explain things thoroughly. Because if you just tell me well, I just found out I'm having a meeting later about possibly having diabetes type 2, and I will, of course, have a lot of questions. So I'm not saying you need to give me a whole lecture, an academic lecture on what diabetes means, but taking the time to explain, how that might have come about, or, just explaining a little bit more. So it's a bit of having a bit of patience and explaining things clearly, and allowing for questions.